Machinga Likwenu, Michel.
Mr. Dennis Gondwe, should the meeting not be in progress?
Hello, madam. Hello.
Kindly proceed with formalities of the meeting, please.
Hello. Yes, madam. Hello.
Assure Machinga Likwenu, but there is a technical thing going around to assess the situation. And I should be able to give feedback once the condition. Thank you. Michelle,
Thank you very much, Mr. Secretary. I would like to ask the Minister.
Hello.
Morning, Dennis. Good morning.
Hello.
Morning, Dennis. There's a background noise in your where you are seated.
Hello. Morning. Hello.
Morning.
Yes, I can. Yeah, I can hear you.
I'm saying there's somebody speaking in the background where you are seated.
Minister of Agriculture.
Yes, Ronald. I think I can see some members on have joined. I think we can proceed. Maybe if you can flag out the concept note and the program, Ronald.
Sure.
Mr. Dennis.
Hello.
Mr. Dennis, it is already after 9:30. Could we kindly proceed with the meeting, please?
Hello.
Good morning, Miss Nyasha. Could you kindly give a background to the meeting and proceed? I don't know what is happening with Dennis. He keeps saying hello, but he's supposed to have started the meeting. The members are waiting. Kindly take over, Nyasha, and assist us. I'm not sure what is happening with Dennis.
Sure, Madam Chair, I can attempt to do that. Good morning, honorable members. My name is Nyasha Chingore. I am from the AIDS and Rights Alliance for Southern Africa, ARASA. We are an organization that is based in Windhoek, Namibia, but works in 18 countries across East and Southern Africa. The meeting today, the background of the meeting today is really a follow-up on our collaborative work with the SADC PF over several years around advancing sexual and reproductive health within the region. Honorable SG, the program indicates that we are supposed to begin with some preliminary SADC PF processes. Should I hand over to Honorable Bertha? Or Mr. Dennis, are you now able to speak?
Good morning, honorable members. My sincere apologies. The committee clerk for this meeting is Mr. Dennis Gondwe, who is supposed to be leading us with the preparations that have been done for this meeting to take place. However, we are not sure what is happening. May I request honorable members that we nominate a chairperson of the day from among yourselves, and we would proceed with the program as scheduled. We would like to emphasize, honorable members, as usual, that this session is being recorded as we speak, and that it will be broadcasted live on various medias. The languages that are going to be used for this session are English, French, and Portuguese. Should you require to make any intervention, kindly include your message in the chat box for the secretary to act on it. And also ensure that at all times when you take the floor, you indicate your name and country that you represent. Honorable members, with that being said, may I kindly request that we nominate a chairperson from among us. This is not peculiar to the Committee on Human and Social Development and Social Programs. Any member or parliament from any committees of the forum may wish to chair the session. May I kindly have volunteers, honorable members? Honorable Mpariwa, would you mind assisting us with the sharing?
Hello. Can you hear me?
Good morning. Yes,
morning.
honorable.
Okay, I will share. That's okay. Thank you.
Thank you very much. I hope you have all the documents before you. I will be dropping my call to call Dennis to find out what is happening. In the interim, honorable member, I would request that Ms. Nyasha assist us with how the program ought to have run. Unfortunately, several staff of the secretariat are on leave and some are not feeling well, and therefore we are unable to be everywhere at the same time. Dennis is in Malawi, a seconded staff. He was supposed to be on this call and he spoke this morning, so I'm not sure what is happening. Let me find out. In the interim, thank you very much, Honorable Mpariwa, for honoring us in this way. Thank you.
Honorable Mpariwa, do you have the agenda for the meeting before you?
Yes, I do have the agenda before me, my dear. Thank you very much. You know,
Okay.
when it's like an ambush, but I think let me take this opportunity to welcome everyone. To welcome everyone to the meeting. A very good morning to you all. It's a good time to meet. It's rather getting slightly warm in Harare. I'm not sure of other countries, but perhaps really to say this is a meeting that has been facilitated so that we all understand the problem which is before us. And let me not waste much of your time. Perhaps just to get the admin the group, since we have lost Mr. Gondwe in terms of connectivity, that if everyone is then registered, we could then find out from the secretariat to ensure that we all have our facilitators with us. And then with that, can I kindly move on to item 3 on the adoption of the agenda, the draft agenda, which runs is presented. Can you show it on the screen so that we have everyone on board? I see that Mr. Gondwe is actually reflecting his face on the screen. Can I have a confirmation on whether he's now on board? Mr. Gondwe, are you with us? Not at all, but we may proceed now that we have the agenda on the screen. I need to verify as to whether we proceed with the adoption of the draft agenda. Secretariat. Hello.
Honorable Mpariwa, I will stand in for the Secretariat for today.
Yes, my dear. Thank you.
Just with one slight amendment in the presentation and discussions. This appears to be an older version. It really, item 3, it should read presentation and discussions on how Parliament in the SADC region can use the principle of BEI to advance SRHR. It's a simple deletion of the word adolescent. But other than that, I can confirm that this is the agenda is set for the meeting.
Oh, great. So to members, can I have a proposal for the adoption of the draft agenda as amended so that we can begin to have our meeting? Any proposal? Can we have adoption of the draft agenda and with the amendment proposed? Silence means yes.
Honorable, yes, thank you. My name is Honorable Desmond Muela from South Africa. I move that we adopt the agenda as presented with the amendment. Thank you.
Thank you very much, Honorable Meda. Any seconder? Honorable members, may I kindly have a seconder?
Hello? Hello? Can you hear me?
I can hear
Yes.
you, Honorable Mohadi.
Honorable Mohadi, I can hear you.
Okay, I second that the agenda should go ahead.
Thank you very much, Honorable Mohadi. Now that we have our agenda adopted, we can quickly move on to the item Roman figure, which is for a presentation and discussion on how parliamentarians in the SADC region can use the principle of BAI to advance SRHR and the sharing of experiences on working with religious and cultural institutions and their constituencies to uproot norms that deny the rights to BAI, particularly the rights to safe abortion in key populations. So can I get a thumb from the Secretariat on whether our presenters are ready with item 4 on the presentations?
Yes, Honorable Mpariwa, thank you so much. And good morning again, honorable members. I will hand over the facilitation of the session from now to our host for the session, or our facilitator for the session, who is the director of the AIDS and Rights Alliance for Southern Africa, Ms. Felicita Hikwam. Felicita, we are a little bit ahead of the program. There were a few things that seem to have been deleted on the agenda without us knowing, but I think we can start the process with you giving us the background to the meeting, the importance of the issues and the part of the agenda. Our first speaker is not yet online. And if by the time we are done with the initial preliminaries, she's not yet online, I think it will be okay for us to move on to the panel first, as I see that most of our colleagues from the civil society are online, and then we can always come back to our first presenter, the Dr. Ms. Natasha Kome. Felicita, is that okay? Can I hand over to you?
Yes, thank you, Nyasha. And thank you, Madam Chair, honorable members of the SADC Parliamentary Forum. It is my great pleasure and honor this morning to join you from a rather chilly Windhoek, Namibia, and to introduce the AIDS and Rights Alliance for Southern Africa, which is also known as ARASA, and our work to promote and protect the rights to bodily autonomy and integrity. There are some familiar faces and names, but for those of you who do not know ARASA, we are a partnership of civil society organizations working in 18 countries across Southern and East Africa. We were initially set up to promote a rights-based response to HIV in an effort to catalyze a strong community response to the rampant violations of the rights to liberty, privacy, freedom of association, non-discrimination, and equality before the law of people living with and vulnerable to HIV in their homes, schools, healthcare facilities, and places of work and workshop, which fueled HIV infections. Recently, we have pivoted strategically to anchor our work in the core principle of the respect for and protection of the rights to bodily autonomy and integrity in order to reduce inequality, especially gender inequality, to achieve health, dignity, and well-being for all in Southern and East Africa. We understand the principle of the rights to bodily autonomy and integrity to mean that everyone has inherent dignity and should have the ability to exercise complete agency over their own bodies, free from external interference, social and legal sanctions, coercion, violence, discrimination, or other forms of interference. For us, the achievement of sexual and reproductive health and rights depends on the realization of their bodily integrity, privacy, and personal autonomy being respected. We also believe that the rights to bodily autonomy and integrity are critical for the creation of just, equal, productive, and resilient societies in which social justice and human dignity are at the center of all development, policy, and organizing, and health and well-being are promoted for all. But most importantly for this meeting, we believe that the rights to bodily autonomy and integrity are core principles that can mobilize and unite diverse allies and stakeholders in addressing the societal and structural determinants of health, addressing gender inequality, and in advancing sexual and reproductive rights, thus serving as a radical touchstone through which we can create a more dynamic solidarity regionally and internationally. We have great respect for the crucial role of parliamentarians in promoting sexual and reproductive health and rights, including by removing legal barriers and enacting legislation which improves access to SRHR. As a result, ARASA has had a long-standing relationship with SADC-PF, which has focused on supporting legislators in the SADC region to fulfill their role in addressing key and emerging HIV, sexual and reproductive health and rights, and other human rights challenges. This work and collaboration contributed to the adoption of the model law on HIV and AIDS in Southern Africa and the SADC Parliamentary Forum minimum standards for the protection of key populations, SRHR, in 2018, as well as the adoption of the motion on criminalization of HIV transmission, exposure, and non-disclosure, and the adoption of Plenary Assembly Declaration to implement the Commission on Status of Women, Resolution 62, Women, the Girl, Child, and HIV and AIDS in 2017. We also co-convened and co-created and developed a resource manual to support parliamentarians to effectively execute their mandate relating to the realization of SRHR in SADC. And following this meeting, we will ask the Secretariat to please redistribute the SADC Parliamentary Forum and ARASA SRHR manual for parliamentarians, so that those of you who have not had an opportunity to engage with this resource yet can have an opportunity to do so. As always, we are very excited to have this opportunity to engage with you on our new strategic priority and to explore how we can collectively influence change in sexual and reproductive health and rights in SADC. Thank you so much for having us. We will start our session following my introductory statements by trying to get to know a little bit more about the members of parliament who have been able to join us this morning, particularly getting to know how far, to what extent you have engaged with the concepts of bodily autonomy and integrity, and what perspectives you bring to this session. But this is also an opportunity for us to warm ourselves up to the content and the subject matter that we will interrogate this morning. And in order to do so, I beg your indulgence and ask you to please open a window on the web browser that you're using to join us this morning. So if you are using Google Chrome, or if you're using Firefox or Internet Explorer, please open a window and type in www.menti.com. So that is www.menti.com, menti, menti.com. This is a platform that we will use to conduct a quick survey. It's quite an interesting exercise, just to see what perspectives everyone is bringing to the meeting. It'll allow for us to collect all the responses onto one screen and to see whether there are synergies in terms of how people have or understand the concepts of bodily autonomy and integrity, but also how you've engaged with it, how you see the role of parliamentarians, and also, as I said, to help us frame the conversation, help us ground ourselves and warm up to the conversation that we will have, going forward this morning. So we are asking for you, please, to join us on www.menti.com and to type in the code 62204468. So once you get to www.menti.com, you can please type in the code 62204468. I'm hoping that the translators are able to follow, and we welcome input from partners and members of parliament joining us from our Lusophone and Anglophone countries as well, or sister countries as well. Please do follow the instructions, and we will ask the translators to please keep up with translating some of the input that we receive, and also once again translating back to me some of the responses in French and Portuguese. So once you get to www.menti.com and you've typed in the code 4468. Once again, the code 62204468, 62204468. A question will pop up on the screen. So there will be a question once you type in the code that will say, or that will read, I own my body when. And this is really to get us to start grounding the conversation in the fact that we all have bodies, but what does it mean for us to own our bodies? What does it mean, and when do we most feel like we own our bodies? So if you could type in your responses, and this is one of those questions where you can type as many words as you want, once we've completed the Menti survey, we will share with you a video that we did with a few of our other allies in preparation for the launch of a regional campaign that we have called Everybody Counts. And we will share some of the responses that we received from other allies and other partners in terms of when they feel like they own their bodies. And it'll be interesting to see whether there's some synergy between, you know, how members of parliament across the SADC region feel in terms of when they own their bodies and what some of the responses are that we will have captured in the video. We have two very brave members of parliament who have entered some responses. Thank you so much. It is really very welcome to get, you know, feedback from you. Someone says, I own my body all the time, which is fantastic. I would have loved to engage with the person who said that and try to understand how and when and how all the time, and also to get to know a little bit more about the profile of the person who said they own their bodies all the time. But the other response that we've received so far says, I own my body when I undress myself, when I see how vulnerable I am, the vulnerability that no one else would understand. That's really very interesting. And it speaks to kind of, you know, how bodies are owned when we are by ourselves, when we are able to be vulnerable, when we are able to, not have to have the guise of other people judging us or watching us. Another response says, yes, I own my body, and please, can I please be protected from sunrise to sunset? Yes, and I believe that is probably and particularly more important during these times of COVID, when, you know, we're losing so many people, to beg for protection from sunrise to sunsets to see another day. And there's another response that says, yes, I do own my body, but I share it with my wife. That is really very interesting, especially when you think about bodily autonomy and who we choose to share our bodies with and under what circumstances we choose to share our bodies. And then somebody else said, yes, I do own my body. That's very interesting. Thank you so much for the 5 people who have shared their responses. We really do appreciate it. It'll be interesting to reflect on these as we move through the program and the agenda and start to dig a little bit more into the concepts of bodily autonomy and integrity. In the interest of time, we'll just move on to our next question, which will be popped up on the screen in a minute. And once again, for those of you who have joined us since we started, we're busy with an exercise to get to know each other a little bit, but also particularly to get to know the perspectives that we bring to this conversation about bodily autonomy and integrity, and also how that links to sexual and reproductive health and rights and limitations or the realization of sexual and reproductive health and rights in the SADC region. We are using the platform called Menti, Mentimeter. It is at www.menti.com, and the code that you can type in when you get to www.menti.com is 62204468. The code again is 62204468. And the next question that we would appreciate some responses to is, which word comes to mind when you hear the terms bodily autonomy and integrity? We have one response at the moment that says mine, talking about it's my body, it's mine. So the term that comes to mind when this person hears bodily autonomy and integrity is mine. We're hoping to receive a few more responses. Thank you. I've seen a few more come in. Freedom, choice, agency, dignity, very interesting, sexuality. Those are some of the terms that come to mind when people think about the terms bodily autonomy and integrity. We have 6 responses so far. Thank you so much. It's really interesting to see the synergy between some of the responses. Freedom of choice, freedom and choice are very similar. Also, just to explain that the way that this word cloud works is that the word that's biggest is the one that is repeated the most. And the smaller the words are, the least frequently they have been repeated or have been entered. And you can enter as many words as you want or as many times as you want. Some of the ones that I see are a bit smaller are mine, sexuality, and clean. Clean is very interesting to me, very interesting. It would have been interesting to hear what that means actually, and in what context. Choice has come up twice in the context of freedom of choice and then choice as well. Very interesting. Liberté, I take to mean freedom, and that has come up 3 times in terms of freedom of choice, freedom, liberté, access to public health, very interesting. Bodily autonomy and integrity, meaning access to public health, very interesting. I think choice also links very well to agency, and choice was, as I mentioned, repeated twice in freedom of choice as well as choice. There's another one that says ownership, right, beautiful. Human rights, self, privacy, reconnaissance, chance, sexuality, mine, dignity. There are a few words that are also being typed in the chat. Yes, you're welcome also to add your words to the chat. So the words that come to mind for Muharukwa, Honorable Muharukwa, is sacred, sexuality, privacy, sexuality, and holy. Those are really very interesting terms, and it would have been interesting to hear in what context these come up when you think about the terms bodily autonomy and integrity. Thank you to everyone who has responded to this question. We will move on to the last question. I'm sure that some of our speakers will also reflect on the responses that have been submitted in response to these questions, because this really does give us an interesting, perspective and information about how, who we're engaging with this morning and what perspectives people are bringing with them to this discussion. So the last question this morning is, does Parliament have a role to play in promoting the rights to bodily autonomy and integrity? We have 5 responses and all of them say yes. Very interesting that there is such synergy in those responses, and an agreement so far amongst the 6 people that there's definitely a role for parliamentarians to play. As we move further into our agenda, we're hoping to facilitate a discussion with members of Parliament about, yes, there is a role to play, but also maybe how have members of Parliament been engaging with other stakeholders or in their mandate to promote the rights to bodily autonomy and integrity. And this can also be in the context of sexual and reproductive health. How have you been engaging with the concepts of bodily autonomy and integrity? And have you been making the link between bodily autonomy and integrity and sexual and reproductive health and rights? And what does bodily autonomy and integrity mean in your context? How does it manifest itself? Interestingly, in our engagement with our other partners, we've been talking about how bodily autonomy and integrity manifest themselves in the African context. What does it mean for a young African woman? What does it mean for a young man in Southern Africa and in SADC region to claim their rights to bodily autonomy and integrity? How does it manifest itself when the rights to bodily autonomy and integrity are stripped from the individual? What does that look like? What does that look like in child marriage? What does it look like in access to safe abortion and some of the other sexual and reproductive health and rights issues that we deal with on a daily basis. So just once again, to repeat that the question is, does Parliament have a role to play? Do parliamentarians have a role to play in promoting the rights to bodily autonomy and integrity? There are 41 people in the room at the moment, in our virtual room. We have 8 responses. It would have been great to see a few more responses, but we do appreciate that having to go to a separate platform, having to open a window, and having to press in a code and all of that may also have contributed to the limited number of responses. But we do appreciate those individuals who have responded to these questions. And we hope to hear a little bit more from those people as well later on in the agenda about how they have been, how they've been fulfilling their role to promote the rights to bodily autonomy and integrity. Thank you to the 9 people who have responded. We really don't take it lightly. We do appreciate it. It gives us a good idea of who has joined us this morning and what perspectives people are bringing with them to the meeting. So with that, we will close our Mentimeter and we will move on to the rest of our agenda. As I promised, we are excited at this juncture to share with you a video that we compiled last year for the launch of our regional campaign called Everybody Counts. And the video features some friends and allies of ARASA, but also friends and allies that have been doing some important work in promoting bodily autonomy and integrity, but also sexual and reproductive health and rights. And this includes Justice Edwin Cameron, who is the former Justice of the Constitutional Court of South Africa, who reflected on the question, "My body is my own when?" which was, as you may remember, the first question that was asked in the Menti, and that some of the honourable members of Parliament responded to earlier. So I'll ask my colleague Hejin to please cue the video and enjoy.
I own my body when every little decision that has to be made about this body is my choice.
I own my body when I'm dancing.
I own my body when I'm exercising.
I feel my body is my own when I pick clothes and I don't have to worry about my parents.
I own my body when I'm telling stories.
My body is my own when I'm taking selfie.
I own my body when I can run the streets of my neighborhood without feeling harassed.
I own my body when I can make decisions about it without worrying what other people think.
My body is my own when I present my ID. I am more than what's between my legs.
My body is my own when nobody dictates what transgender looks like.
I own my body when I get a compliment about my femininity.
I am unapologetic. I am intersex.
I own my body when I decide what to do with it.
I own my body when I exert it, when I extend it, when I exercise it, but also when I use it to show respect and awe for the bodies of others.
I own myself when I decide if to have children, when to have children, and how many children to have.
I own my body when I say no to sex.
I own my body when I have sex.
I own my body when I honor its needs and wants, despite societal expectations and norms.
I love this body. I love these curves. I love all of them.
I own my body when I have no fear. No fear of movement, no fear of expression.
This is my body. I am confident and proud about my cultural attire.
I own my body when I don't wear a bra without worrying whether my boobs are saggy or people will stare. Hashtag free the tatas.
When my body belongs to only me. I'm not a mother or a daughter. or an employee or a friend or a sister. I'm just mine. When it comes to me, that's when my body is my own. In a nutshell, I guess.
Thank you, Hejin, for playing that video. I hope that the members of Parliament enjoyed that. It was really very interesting for me as I was watching that once again to reflect on some of the responses we received earlier in the poll, in the Menti poll from members of Parliament who said, I own my body, when I'm in front of the mirror after I've taken a shower, I own my body, but I share my body with my wife. I own my body all the time. And I think the main takeaway for me from that video and the responses is that, we all have bodies and to varying degrees feel that we own our bodies in different contexts, in different circumstances, and under different conditions. We will hear a little bit more about some reflections related to that, but also how our civil society partners have been engaging with members of Parliament, and then also the role of members of Parliament and what members of Parliament have been doing already and in their specific context to engage with other stakeholders, including religious and cultural institutions, to address and uproot norms that deny the rights to bodily autonomy and integrity. Our next speaker, I believe, was just joining us, Dr. Natasha Kauma from Zambia, who's the executive director of Copper Rose, an organization that works with adolescent girls and young women. She's a medical professional and will speak to us about how bodily autonomy and integrity is a good medical intervention. I just want to check whether Dr. Kauma has joined us. I know that she was having some challenges with connecting. Oh, there she is. Good morning, Natasha. I see that she's joining and connecting with audio. Just by way of introduction, as I mentioned already, Dr. Kauma is the executive director of Copper Rose, which is an organization that works with adolescent girls and young women. I have personally a lot of respect for the work that they do, and I look forward to hearing you speak, Natasha. Please go ahead.
Thank you. Good morning, everyone.
Morning.
All right.
Morning.
Good morning. I feel a bit weird to be joining in late. I kind of feel like I haven't really gotten to say hi. But with this virtual communication, things happen. So my name is Natasha. I'm based in Lusaka, Zambia, and I am a global sexual and reproductive health champion. I work mostly with adolescent girls and young women, and I'm very passionate about working with young people. I'm coming from an organization known as Copper Rose, which is the biggest youth-led organization in the country. I also have done some global work on reproductive health. I sit on the Family Planning 2030 reference group. I also sit on the UN Every Woman, Every Child high-level steering group and many other boards around the world. I'm really grateful to be invited to speak here, and thanks to Arasa for the invitation. I'm going to be speaking about protecting bodily autonomy and integrity as a good medical intervention. Next slide. So we may be asking ourselves, what is bodily autonomy and integrity? In a nutshell, it's the right, or it means the power or the ability to make choices without fear of violence or having someone else decide for you. It means being able to decide when or whom to have sex with, being able to decide when you can get contraception, and it also comes with the freedom to go to a healthcare provider whenever you need one. You can see that picture has some little girls just learning about their bodies, and really it's the ability to not only learn but to exercise everything that one has learned about making decisions about their own body. Next slide. So when people think about bodily autonomy, mostly they think about reproductive health. And a lot of people are in these spaces and there are so many acronyms thrown around, but sometimes people may not understand what exactly is involved in reproductive health. So I will be able to just give in a nutshell, what are some of the thematic areas? So some of the thematic areas are access to contraception and information services, access to safe abortion and abortion care services, maternal health care services, prevention and treatment of HIV, as well as comprehensive sexuality education, violence against women and girls, and rights of marginalized populations, particularly adolescents, sex workers, and the LGBT community. Next slide. So we may be asking ourselves, what is the current situation in our region, in the Eastern and Southern African region? Next slide. In the Eastern and Southern African region, about 32.4% of the population is adolescents and young people. Now, many people love to call themselves young or adolescents, depending on how youthful they feel. But the accurate description of the age group is between 10 and 24 years old. So 32% of our population is between that age group. And it is anticipated that this age group will have about 1.1 billion people by 2050. In Eastern and Southern Africa as well, 35% of women are using modern contraception, only 35%. And the unmet need, which is the number of women that would want to have contraception but do not have access, is around 22%. 37% of children are married before 18. The adolescent birth rate is at 110 per thousand, meaning that for every 1,000 births, 110 are done by adolescent girls aged between 10 and 19. More than 50% of those living with HIV are currently from the Eastern and Southern African region, which translates into about 1,300 deaths per day. The condom use in our region is about 45%, and 15 to 30% of the population report having intimate partner violence. Maternal mortality is at 407 per 100,000, and from the 23 countries in the Eastern and Southern African region, 11 are at a high risk of a humanitarian emergency. Next slide. So when we think about bodily autonomy and integrity, there are some parameters that have been developed to measure some of the progress that has been made. According to the UNFPA State of the World report, if we use three measures, which is the power to say no to sex, the power to decide on contraception, as well as the power to decide on healthcare, we will see that for the sub-Saharan African region, only about 48% of women aged between 15 to 49 have all these indicators checked, which means approximately 90% of women have power to decide on contraception, but only 71% of women have the power to decide on healthcare. Now, deciding on healthcare, we are mostly thinking of only reproductive health, but other practicalities of deciding on healthcare is deciding on whether to have a surgery or not, for example, whether to have certain treatments or procedures done or not. And that's very, very unfortunate that a good percentage of our population is still not able to make those decisions. Next slide. So what are the current barriers to exercising full bodily autonomy and integrity in our region today? The first thing is that governments are afraid to invest in reproductive health because of fear of backlash. I come from Zambia, and Zambia is declared Christian, but there are many other countries as well where they face a lot of religious and cultural barriers. And this puts the governments at a position where they are afraid to fully invest or fully speak out either for or against because of the fear of the backlash from their citizens. In spite of the achievements that have been made in the region, there are some countries that have made progress. But the challenge is that the indicators are not seeing a lot of progress because some regions, like urban areas, have better access to healthcare services compared to rural areas. And if both of those areas do not have similar progress in terms of achieving some of the bodily autonomy targets, then the whole country will have poor data and poor statistics. Marginalized groups are also not on the implementation agenda. When we think about adolescent girls, we think about the LGBT community, sex workers, those populations are usually not on the implementation agenda for most of the programming. Next slide. Just go to the previous slide. I think there's yes. Another barrier. So they look identical, but the text is not the same. So the next slide, yes, perfect. So another barrier is the limitation of the contraceptive options. When we think about women's bodies, it becomes a political issue because right now there are some countries that are on a mission on increasing the population size. Now, there's no harm in that because we've seen that sometimes population size does equate to economic development as well. We've seen the likes of China and Nigeria and many other countries. But the problem is that when we decide to grow the population rapidly, it should come with a growth in health services because poor family planning methods also come with other implications, which I will talk about later in this discussion. But the limitation is that there are countries with different interests when it comes to population, and that culminates into women not having choices. I mentioned something about religious and cultural barriers, but these are also being reinforced not only by leaders, but even at individual level. And lastly, there's a lack of understanding of the importance of bodily autonomy and integrity interventions. For example, there are a lot of discussions around comprehensive sexuality education, and most of these are coming from a lack of understanding. Next slide. So I want us to do a personal reflection, and I want to encourage people to type in the chat box. But I'll give us 30 seconds, and I want us to think about what is your most significant memory of your own adolescence? From the time you were 10 to 19, it would be great if you just typed in the chat box something you remember about that age. If we were in a room right now, I would have asked people to write on sticky notes and stick them somewhere. But for now, I will ask people to just type in the chat box in 30 seconds what their significant memory about their adolescence is. It doesn't have to be about reproductive. It can be anything. If you have to remember one thing about your adolescence, what's the one thing you remember about that time? Okay, so most of the messages are talking about being calm. I can see people talking about crying, the hell of high school. But you'll find that when I ask this question to most people, even people in their 30s, even people in their 40s, their biggest memory of their adolescence has to do with reproductive health. Often it's around things to do with when they became of age, puberty, and things like that, which just goes to show that this age group is very, very important. And a lot of the complexities around bodily autonomy happen at the age of adolescence, which is why most of the bodily autonomy interventions need to start really young. Next slide. So it's just so interesting to see some of the comments. But I'll zero into why we should invest in bodily autonomy and integrity interventions from a medical perspective. When we think about bodily autonomy, we also need to think about things like access to safe abortions. According to research done by the World Health Organizations, countries where they have induced termination of pregnancy restrictions, what ends up happening is that these services end up being only for the rich. So the poor women or women with less financial abilities usually have more of the bad effects of poor access to safe abortions. It's also important to note that 45% of abortions are unsafe. In Zambia, where I come from, 30% of maternal deaths are due to septic abortions. What that means essentially is that if women decide that they want to terminate a pregnancy, when we set laws that prohibit women from accessing these services, we are not changing their minds. We are not restricting them from doing it. We are just increasing the occurrence of unsafe abortions. We are increasing the occurrence of abortions done in the streets. Because what happens is that women who decide that they want to terminate their pregnancy will do it whether or not the healthcare providers will do it at the facility. I have had instances where women have been sent back because of either nurses with cultural and religious decisions send patients back, and they come back as septic. So the need to invest in bodily autonomy really is not from an individual's perspective. I think that we need to look at the statistics, and we need to allow the statistics to guide us, because once women are sent back or once laws are restricted, it doesn't make the abortion stop. What happens is that it increases the occurrence of unsafe abortions. When we look at the statistics, it shows that in countries where abortions are legal, only 9 out of 10 abortions are safe, and only 10% of them are unsafe. So that is one of the reasons why it is very important to think of it in that sense. Next slide, please. Another reason to invest in bodily autonomy and integrity interventions is looking at it from a family planning lens. Right now, 214 million women in developing countries have an unmet need for modern contraception. So what that means is that more than 290,000 women are dying from unintended pregnancy-related causes in developing countries each year. And unintended pregnancy, some of the impacts are on our girls, because what happens is that 19% of our girls become pregnant before they turn 18. What that means is they drop out of school, it reduces their ability to contribute to the economy, and it increases the occurrence of complications during the birth and delivery. You find that young girls that have pregnancy or are delivering have more complications. They are at risk of more surgical interventions during deliveries. They are also at risk of bleeding during delivery, as well as some of the maternal deaths could be attributed to a young age. Next slide. Another reason, so we need to think about why we should invest in bodily autonomy and integrity. And right now in the region, there are a lot of discussions around comprehensive sexuality education. There's an idea that comprehensive sexuality education leads to earlier sexual activity and riskier sexual behavior. But research has shown that there is actually a reduction in risky sexual behavior, because once a young person understands the whole scope of sexual activity, it looks more of a responsibility, because they have to think of contraception, they have to think of STIs. And in countries where comprehensive sexuality education programs have been implemented effectively, what they've seen is an increase in the age of sexual debut. And in our region, about 60% of programs that have been implemented on CSE have shown an increase in behavioral or biological outcomes, such as increasing condom use and reduction in unintended pregnancy. I must mention to you, honorable members of parliament, that while we may want to think that abstinence programs are effective, they do not work. And research has shown that the average age of sexual debut in this region is about between 12 and 14 in many of our countries, some countries up to 16. So between 12 and 16, whether we like it or not, our children, our sisters, and our young people are starting to indulge in sexual activity. And so abstinence programs are not effective. Next slide. Lastly, one of the reasons we should invest in bodily autonomy and integrity is we have seen that through several comprehensive reviews that the lesbian, gay, bisexual, trans, and gender non-conforming persons are at a higher risk of physical and sexual violence. And in most of these cases, their sexual orientation has played a role in the perpetration of these crimes. And one of the things also is that it delays their ability to access sexual and reproductive health services, because if they feel that they are discriminated, they will stay back in the community. And what we see is that we will see an increase in things like HIV transmission, as well as an increase in sexual violence as a whole. Next slide. So I will, in the last 3 minutes, look at some of the suggested responses in looking at it from a solutions perspective. What do we need to do? One thing we need to do is we need to implement comprehensive sexuality education in schools, because education is one of the ways in which we can even reduce things like stigma, things like poor understanding. And this has to start from people at a young age. In many countries, CSE has been implemented from as early as 10 years of age. But one thing that is important is that it needs to be age appropriate. There is also a need to target men in many of the programs, because currently most of the programs are targeted towards women. But we need to understand that men and boys need to be involved in their partners' health as well as their own. Another response is that there are currently a lot of bills and a lot of laws that are being enacted to contribute to meeting reproductive health needs. But one thing that we are seeing is that in some countries, there is poor harmonization of these laws. Next slide. So there's poor harmonization of these laws. When we look at things like age of consent, we're thinking only of age of consent for reproductive health services. But one way to do this would be to implement this as a package. So in Zambia, for example, we're thinking about age of consent, not only for sex and things to do with reproductive health, but it's also what is the age for surgery? At what age can someone access surgery? At what age can someone authorize their own HIV test? At what age can someone take up some of the self-care interventions that are being rolled out in the country? And once it is packaged as an age of consent for all health services, it is much easier to justify to our constituents. There's also a need to track implementation of programs, as well as to disaggregate data and use data and evidence for decision making. In many countries, we have all these healthcare systems that have been put in place, but the data is not disaggregated by age. And so it is not easy for us to make decisions for certain age groups or certain communities because we simply do not have the information. Next slide. So in a nutshell, when we think about bodily autonomy and integrity, it's very important for us to think of it not only from our individual values and our individual ideas, but one of the best places to look is at the data. And the data is supposed to be able to guide us, and it's supposed to be able to show us what the right way to go is in as far as decision making for our constituents is concerned. Thank you so much, and I'll pause here for questions.
Thank you so much, Natasha. That was a very, very compelling presentation, and it made a really good argument for why bodily autonomy and integrity is a good, or protecting the rights to bodily autonomy and integrity is a good medical intervention. I will now give an opportunity to the honorable members of Parliament to ask some questions or to pose any questions to you based on your presentation, but also to share any reflections they may have, anything that's come to mind or has been triggered by the presentation that you just delivered. Honorable members of Parliament, you can either raise your hand or you can type a question or a comment in the chat box. I'm sure that you also appreciated that presentation as much as I did. And we want to give you an opportunity to ask a question or to just engage with Dr. Kauma while she's still with us. I see someone's put on their camera, but I'm not sure whether they're ready to speak. You can raise your hand. You can use the raise hand function. It is next to the interpretation button. When you click reactions, at the bottom, there is something that says raise hand. I've just used it. So if you want to intervene, if you want to share something, you can use the raise hand function, which is under reactions and it's at the bottom. Or you can type a question or a comment. We have about 49 people on, and I see one hand from the honorable member from Lesotho, Honorable Hinsala. Please, can you go ahead?
Thank you so much. I highly appreciate the presentation we have today, especially when our presenter was talking about CSE. I'm very, very interested in that one because in my country we have already started implementing that policy in some schools. So I think what we have heard from our presenter today, it's basically encouraging some of us who are a little bit probably low in that policy of CSE. So I really don't have much, but we have realized that the SE has to be implemented in as early as a child is 10 years old. So that at least they should be aware of the importance of this of their bodies, and to take good decisions on what they have to do in as far as sex is concerned. I think that's all I can say. Thank you so much.
Thank you so much, Honorable. And just as you were saying that, I was also thinking about recently in Zambia, and I'm sure Natasha can speak to this a little bit. There was some pushback against the implementation of CSE in schools. And if I'm not, wrong, parliamentarians actually played a very important role in, pushing back against the pushback to ensure that CSE was being delivered in schools. So that is also an example of where parliamentarians have played a role to protect access to comprehensive sexuality education for young people and for children. I see that there's a note in our chat from Muharukwa, just saying, sorry, not that one. I wanted to read the one about the SADC PF media officer is asking that the honorable members please switch on their cameras when they're speaking, because this broadcast is being, this meeting is being broadcast live on DSTV channel 408 and also on various social media platforms. So please switch on your camera when you're speaking. And then the comment from Honorable Muharukwa that says the majority in Namibia where I am starts at 21 years. I believe this is a sexual activity. For parents who seek to protect the adolescents from sexual activity are faced with the question, whose body is it? What is the best way to say a father to make a young girl understand? Honorable Muharukwa, if you don't mind, could you please repeat your question, by putting on your microphone and your camera? I'm not sure that I will be able to represent your question fairly. So, the mic has a problem. Okay. So, Natasha, you've seen the question in the chat. It would be great if you could respond. Let us just take one more comment from another member of parliament. This time we will go to the member of parliament from the Seychelles. Please go ahead.
Thank you, Madam Chair. In fact, sorry for being late because I had other commitments and I joined a bit later. Thank you. And I'm very interested into the topics, and it was from whatever I've sort of followed up, and plus the resource materials that they have sent. It's brainstorming. But one thing is that about the comprehensive sexual education in school, I listened to Lesotho mentioning about the issues of implementation. In Seychelles, we have implemented it, but we have sort of rebranded it so that it features in a holistic manner. It is called personal social education. So it starts with personal issues like hygiene, bodily hygiene, and so on and so forth, and then social activities. And at the same time, we have started for more than 10 years ago, 10 or 11 years ago, that it's sort of institutionalized into the curriculum, but it's not examinable. And we have started as low as children from 7 years onwards. But it's based, the implementation is based according to age group, right to adolescence. So this is one thing probably other countries should look at, sort of rebrand it to start to have a holistic approach so that the children can adapt, and at the same time, they can feel that they are part of their body. So that it's not only about menarche, but it's about everything that comes with bodily hygiene and so on and so forth. That's my contribution. Thank you.
Thank you so much, Honorable, for the contribution. We'll take one more comment or input from the Honorable Mpariwa, and then we'll give Natasha an opportunity to respond to the comments we've had so far and the questions. And then we'll come back and have another round of discussion with members of parliament after we take our panel discussion from our civil society partners. Natasha, please go ahead and respond. Honorable Mpariwa, please go ahead.
Yes, thank you. Let me begin thanking all our presenters for brilliant presentations, but perhaps just to pick from the presentations that have been made in terms of the research that has been carried out, what type of legislative provisions would promote this subject matter, since it's not easy to put some of the issues in the constitution. I mean, all the national constitution. You cannot be able to actually put it as an issue in the constitution. I know it's about rights. I know it's about both the gender, but in terms of best practices, what could be the best way in terms of actually getting this important subject matter? Thank you.
Thank you, Honorable. I will hand over to Natasha to respond to some of those, and also to any of my other colleagues, maybe Nyasha from Arasa or anyone else who wants to respond to particularly this last question around, what type of kind of legislative process or, process can we follow and to protect rights to bodily autonomy and integrity.
Thank you so much. These are very important questions, and this discussion is very, very important. I will start with the comprehensive sexuality education discussions. Honorable from Seychelles, I think your approach is the right way to go. CSE is something that needs to be embedded in the curriculum. One way, for example, that in Zambia we were able to succeed the pushback is, first of all, there was pushback from religious groups sometime last year. And this came from mostly some religious movement, which was a global movement going against comprehensive sexuality education. And this was a heated discussion. Some of the reasons why we were able to succeed with continuing with the comprehensive sexuality education is, first of all, this CSE is embedded in the curriculum. So it is in every single subject and it is examinable. What that means is that when people come and say we want to remove it, you have to stop the whole curriculum for all the subjects in which it is taught. Now that makes it more complicated and it makes it harder to uproot or to remove, or if a new leader comes, it means a whole curriculum overhaul. And that makes it harder. And those are some of the steps that can be made to ensure that it is not something that anyone can just wake up and remove, or if there's a change of government or there's a change in leadership, it becomes harder to adjust. The second thing is also the rebranding and the naming of what it is. I love what you said about how it is called in decisions, which is personal social education, because it is really a life skills development as well. One other aspect of CSE that we need to think about is a life skill. Some of the life skills that are embedded are things like decision making. While we may want to think that most of the decision making training is happening in homes, sometimes it isn't. Parents nowadays are busier, but also young people have access to information. So the first mistake parents can make is comparing themselves to their children, because a long time ago, if your mother said, don't play with a boy, you couldn't and you believed her. But now you can Google if it's true that your ears will grow longer or your nose will grow bigger, and those things that our parents taught us. So this is an information age. So if we don't give information to our children, they will Google it. And that's a reality we need to come to. And that's what CSE intends to do. It intends to contextualize the information in a way that they can understand in bite-sized pieces from a young age, so that even as they Google, they would have learned it from school, from their teacher, the right way. And that's one of the most important things. Now, there was a question around one, how to deal with political resistance around subjects like abortion. I'll give you an example. The abortion laws in Zambia are exactly the same as the abortion laws in the UK. But when you talk about access to these abortions, the access picture is completely different. So one of the ways that some of these laws you can deal with political resistance is to flatten the law. For example, reducing the number of requirements, or looking at it not from exactly adjusting the law, but looking at how can you work with what you have within the current law, what provisions can be made. Some of the provisions that have been made in certain countries is some countries had a statement that says an abortion can only be conducted by a registered medical practitioner. So what some countries have done is they've adjusted the definition of who a medical practitioner is to not just being a doctor, but any healthcare provider who has a trained practicing license. So those are some of the ways of going around some of the complexities. But I do understand in some of the countries, the law is explicit to say it's only allowed for rape, or it's only allowed for if there's a medical condition that impedes access. And these are some of the ways that it can be done. One way to also do it is to make it a gradual adjustment over time. I know that some countries have made it a gradual adjustment, sometimes just adjusting the guidelines, operational guidance, and not adjusting the law itself to become more allowable. And I know that is very complex, but doing it in a gradual sense, step by step, is one of the ways to go around it. I think the last question was on how to make, I saw it in the chat box, on how to make parents understand. Let me just go back to it. The best way for a father to make a young girl understand. I always say that parents when we think about reproductive health, I want us to think of it in terms of how much things have changed. 30 years ago, people were married by age 18. or even 50 years ago, 100 years ago, they were married by age 18. And so things like sexual education didn't really matter, because by the time one was sexually active, they were already in a matrimonial home, or at least close to it. But nowadays, you find that people reach puberty at 12, 13, but they get married at 30. And during that time, they are sexually active. So the period between which we think of sex as culturally acceptable is increasing over time. And that's why things like comprehensive sexuality education, access to contraception, access to information are very important, because while the world is changing, our values are changing at a slower pace than they should. And when we are defending some of these things in parliament, in different spaces, this is the lens with which we need to look at it, to say the world is changing faster than we think it is. And our values are changing much slower, because even our own children are getting married later than they did, but the messages are still that people should wait till they're married. I'm not going to look at it from a religious perspective for the purpose of this discussion, but I just want us to think about what kind of advice we would be giving in our homes and what that translates to at decision-making level. I hope I've answered all the questions. I will pause here for now and over to you, Felicita.
Thank you so much, Natasha, Dr. Kauma, for your responses, and also, just for sharing so much of your experience and your knowledge. The last question by Honorable Mpariwa, I think, is quite an important one in terms of how parliamentary processes can help advance the rights to bodily autonomy and integrity. And I'm going to actually do something really tricky, right? I'm going to allow my colleague Nyasha Chingore to respond to that question, and also while she responds to that question, introduce the civil society panel, who will also speak to how parliamentarians have been promoting the rights, or how civil society has been working with parliamentarians to promote the rights to bodily autonomy and integrity. I realize that we are running behind a little bit, and I do want to allow some time after the panel discussion also for some input from the members of parliament, but also want to be respectful of their time and the fact that they have other pressing commitments this morning. So I will quickly hand over to Nyasha to respond to Honorable Mpariwa's question, but also then to introduce the civil society panel and take it from there. Nyasha?
Thank you so much, Felicita. And good morning once again, honorable members. Just in relation to Honorable Mpariwa's question, I think the one thing that I did want to highlight to start with is the fact that even as we have these conversations in parliaments with our constituencies around bodily autonomy, protection of bodily autonomy and integrity, for populations at large, but vulnerable populations in particular, that to remember that we do, a lot of us have a fallback on our constitutions, and that a lot of the conversation that we're having now about bodily autonomy and integrity relates to human rights and constitutional rights that are already protected in our constitutional frameworks. So, for example, when we talk about bodily autonomy and integrity, a lot of our constitutions contain a right, the right to integrity, to security of the person. And that is the right that correlates directly to this issue of bodily autonomy and integrity. Some of our constitutions provide a constitutional guarantee of the right to dignity. And the right to dignity relates directly to the right to bodily autonomy and integrity. Many of our constitutions also provide for the right to the highest attainable standard, or they provide for the right to the highest attainable standard to health, or they provide for other rights that we can actually utilize to make these arguments around the protection of bodily autonomy and integrity. So I think a starting point is that these are not new rights. These are rights that we do not respect in our national constitutions, but also as Africans. One of the things that I always highlight is one of the core fundamental cores of the African Charter on Human and People's Rights is dignity. And, rights such as prevention of from cruel, inhumane, and degrading treatment, which a lot of us have in our constitutions, relate directly to issues of access to safe abortion and women not being able to access life-saving services or services that could result in dilapidation of their health. Or, for example, mistreatment of key populations can directly be linked to rights such as the rights to protection from cruel, inhumane, and degrading treatment. In terms of processes that are happening in Parliament at the moment in a lot of our countries, I know that many countries are at the moment having some conversations around, for example, the access to abortion provisions. I know these conversations are happening in Malawi, they're happening in Zimbabwe at the moment, and in many other countries as well. We also need to look sometimes at when processes are happening around laws that might not necessarily directly be linked to the issues of sexual and reproductive rights. So, for example, when there is a general amendment to the Criminal Laws Act, a lot of the times the criminalization of key populations, vulnerable populations, access to abortion is actually sitting in the criminal code. And that presents an opportunity for us to have these conversations. When conversations are being had around the laws that regulate civil society and NGOs, for example, a lot of the times the laws that restrict key populations and vulnerable and marginalized populations, including LGBT communities, from being able to engage with our governments sit in those particular type of legislations. So there's so many opportunities at the moment across our continent where issues of bodily autonomy are being discussed. Some of them, it's very clear that this is in relation to SRHR. Sometimes it's not so clear, and it takes a little bit of conversation around how this might actually have an impact on SRHR. So now I will take the opportunity to very quickly invite the civil society colleagues that are on the call, who we had asked to come in and share a little bit of their own experiences working with parliamentarians at local, at national level, and also just answering this question of what role could parliamentarians play in advancing the rights to bodily autonomy and integrity. Our parliamentarians are ARASA partners that are currently implementing bodily autonomy and integrity programs within various countries across the region. We have a participant from Namibia, Abigail Solomons. We have a participant, and colleagues, kindly switch on your cameras as I introduce you. We have a participant from Malawi, Nyatue Piri, and we also have a participant from Botswana by the name of Dumiso Gatsa. Colleagues, please do switch on your cameras. We are a little pressed for time now, so I will give you 3 minutes to each one of you to just, give us your intervention on this panel. May we start with you, Abigail, and I will show your slide.
Okay, fantastic. Good day, honorable members, all protocol observed. I'm Abigail Solomons from Positive Vibes Trust in Namibia, a programs manager of the T Soroske project, which translates to It's My Body, that aims at advancing narratives on bodily autonomy and integrity in Namibia. So our work in the field of SRHR requires us to work at various levels, at community, individual, with country and regional policy and strategy, and within our respective legal frameworks. Through the implementation of national and regional processes on participatory community-led monitoring of health facilities, engagements with specific community groups, including health practitioners, on 5 universal characteristics of good healthcare: availability, accessibility, affordability, acceptability, and accountability, a stark truth has been revealed. Women who have sex with women who identify as lesbian, bisexual, or queer, and female body trans men are routinely the silent victims of a health system built on heteronormative and patriarchal assumptions. So when engaging with concepts around bodily autonomy and integrity, we've consistently been using this lens on who really is being affected, who is marginalized within our local communities, and whose rights to bodily autonomy and integrity have not been realized in spaces. So what does invisibilization look like within our SRHR response for this particular groups? Many sexual and reproductive health services are available for women. In general, these services are based on the assumption that all women are the same, cisgender and heterosexual. Very few services, including information and counseling, are specifically available to women who identify as lesbian or have partners who are either exclusively or occasionally women. This applies even more so for our trans community, who remain largely foreign, exotic to our health response. When services are tailored to meet specific vulnerabilities and the need of specific population groups, these services are also largely inaccessible to LGBTQ women and female-bodied trans diverse persons. Let's take a look at responses targeting specifically key populations. So key populations and LGBT is language used within a health response and within community to mean the same thing. Technically speaking, however, key populations is not a language of identity, regardless of how that terminology has been appropriated and reclaimed by LGBT groups and sex workers to self-reference. The language is epidemiological. It is a health response framing through which we understand, manage, control, and ultimately eliminate the threats that are HIV and AIDS through targeted HIV interventions amongst those that are disproportionately affected. For LGBTQ women and trans men, this is an important consideration. Whilst heterosexual women are seen to be highly vulnerable to HIV across the region through transmission by their male partners, epidemiologically, LGBTQ women, lesbian, bisexual, and queer women, and trans diverse persons, female-bodied trans diverse persons are perceived to be at negligible risk. Priority in programming is given to gay, bisexual, and other men who have sex with women, and to sex workers, and to heterosexual women. While many facilities include LGBTQ women and trans men when referencing key population groups they work with, products, commodities, prevention methods, and information that meet their unique sexual, reproductive, and mental health needs are not always available. While existing in theory and usually at the front lines, working as KP mobilizers, peer counselors, case workers, unless engaged in sex work or adolescent girls and young women, LGBTQ women, trans diverse, female-bodied trans diverse persons' unique vulnerabilities is unacknowledged within our KP response. The invisibilization of this group and the prioritization of groups is also then linked to a dearth of evidence currently focused on this particular group. What we don't know, we cannot program and plan for. LGBTQ women and trans men data is subsumed within data sets that make heteronormative assumptions on what constitutes womanhood. We assume that all women are the same, but unless the purpose of the study is specifically to explore the vulnerabilities, needs, and context of LGBTQ women and trans men, most studies revert to heteronormative assumptions relating to the types of sex women have, the types of reproductive and sexual needs women have, the types of sexual relationships we engage in, which in turn influences the kinds of questions that we ask, which then translates into policy and strategy. Country and regional policy, unless specifically to cater to specific populations, are often heteronormative and assume a homogeneity amongst population groups. Many of our strategies at SADC level and within our regions often make no mention of LGBTQ women and female-bodied trans diverse persons. And when they do mention trans diversity, this often translates into interventions targeting trans women. Policies and strategies integrating gender considerations almost assume women who are cisgender and heterosexual. Women and their sexuality, their bodies are in essence functions then of men. Unless they're having sex with a man, they are not considered a candidate for policy or for strategic address. The lack of acknowledgement fuels the never-ending cycle of limited national budgeting for LGBTQ women. For trans men, lack of focused interventions, procurement of commodities, and development of communication materials. Lack of information, access to specific commodities such as dental dams, finger condoms, PEP and PrEP is also under-resourced for these particular groups. But then what does visibility look like? Acknowledging and integrating bodily autonomy and integrity as fundamental concepts within our SRHR response leads to visibilization. For us sitting in the space, for many of the decision makers sitting in the space, it is realizing and planning for effective rights forward, equitable policy that cannot exist when we do not acknowledge bodily autonomy and integrity. When we still have disclaimers, but not all women on SRHR services that apply to populations deemed epidemiologically insignificant. Underserving LBQ women and trans men is to a detriment of general and HIV-specific health outcomes and to the full expression and realization of human rights and gender equity. Equal does not necessarily mean the same. We are different people with unique needs, unique identities, different people that need our equal treatment that is appropriate for who they are and what they need, not simply the same as compared to others. We need to take into account gender, sexual orientation, and with easy reach of people who may face, and we know that this is the case for many of us sitting within Africa, facing many other barriers, social, economic, class, physical, legal, and environmental. So to end, highlighting, making visible the needs of LBQ women and female-bodied trans diverse person is a significant step for us working within community as in the civil society space, in working with the decision makers, policy makers, and within the broader health fraternity. I thank you.
Thank you so much, Abby, for that intervention. And I think it's important because you really brought to the fore the importance of recognizing the vulnerable within the vulnerable and the invisible within the group or the class that we often talk about as being vulnerable, that even within that, there are others who are more vulnerable than others. And I think that is a really important point that you make, that even when we have these conversations around, you know, what needs to happen for women, we must not forget those who are even more invisible and even more vulnerable within this group. Thank you so much, Abby. I am going to turn over now to Dumi.
Thank you, Nyasha. I hope I'm audible. 4 quick points with a quick context. And the context is Botswana being the 2nd highest in reported rapes globally and the 8th most unequal in the world. And so I think to answer the question is really about increasing the means for participation, as they have been successes in engaging stakeholders such as traditional leaders, local government and development partner representatives. You do not need to reinvent the wheel necessarily, but rather scale communication and coordination across multiple multi-stakeholder forums such as the National Gender Machinery, National Child Rights Council, and its mechanisms, as well as technical working groups, usually facilitated by the Ministry of Health and Wellness or the National AIDS and Health Promotion Agency. The second is in engaging civil society led by LGBTI, youth, and sex worker communities by questioning who's not in the room and adopting intersectionality and feminist leadership beyond gender binaries and linear programming constructs. This requires seeking out outliers and grassroots communities such as trans, non-binary, and lesbian youth through their constituency offices, strengthening evidence-based decision-making by meeting their communities, those vulnerable and at risk of stigma, discrimination, ableist policies, violence, and poverty, and ensuring that some of these multiple impacting vulnerabilities are addressed. A success is in showcasing a documentary on unsafe abortion, currently ongoing, held by the Ministry of Health and Wellness in an assessment review and follow-up forum for unintended pregnancies, contraception, and unsafe abortion. A third point is in advocating for period dignity through public statements, honoring civil society initiative invitations, and engaging private sector communities to align their corporate social responsibility with the interests of young women and girls in their diversity. 1 in 10 girls in Africa do do not go to school because of period poverty, and having donated just over 4,200 packets of pads for 1,109 girls with a repeated 708 for 3-month cycles, Success Capital strategically engages political leaders, most notably being a member of parliament and the current Assistant Minister of Presidential Affairs being the biggest supporter. And I think that's one tangible way of taking action and creating a convening with multiple stakeholders. The last point is around linking and bridging commitments in human rights with sustainable development. And I think this is key to leaving no one behind. And this doesn't go without speaking to the need to ratify, domesticate, and promote the Maputo Protocol as well as the African Youth Charter. And also really questioning how these can be operationalized, how they're implemented in parliamentary submissions from the executive and civil society, because I think this can actually ensure that there is some form of alignment in discourse, deliberations, and policymaking to the nation's Vision 2036 and Africa's Agenda 2063. I think this is the only way of strengthening and safeguarding bodily autonomy and integrity. I hope that met your 3 minutes, Nasha.
Thank you so much to me. That did meet my 3 minutes, but some really, really powerful and I think very practical interventions in there for parliamentarians and how to engage. I think you really reminded us a lot is going on. So I like that. We don't need to reinvent the wheel. A lot is going on, but this is how we can amplify a lot of the stuff that's going on. I think a really important point around intersectionality, just emphasizing that point that Abby made around making sure that everybody's at the table and parliamentarians actually seeking out, looking in the room and asking themselves who's not here, that we need to hear from because they are part of our communities. And then I think the other one that I really liked, which was very practical, was your plea for our honorable members to honor your requests to help them out when having these conversations. And of course, that last point around linking the human rights to the development agenda, because that is really important, and that makes a lot of sense. Thank you so much, Dumi. I know 3 minutes is not a lot, but you gave us a lot. And now I will turn over to Nyatue. Nyatue, are you still with us?
Yes, I am. I hope everybody can hear me. Yeah.
Yes, we can hear you.
All right. So briefly, I would just like to highlight that I'm part of the Coalition on Prevention of Unsafe Abortion. I'm part of the current board right now, and I work for the Center for Human Rights and Rehabilitation in Malawi. So we are a leading human rights institution that's been there for about more than 20 years. So briefly, if I could just point out that I have a few points that I feel would be a reminder to our honorable parliamentarians to take home when they're looking at the agenda on safe abortion. But then I would also want to just say and point out, because there's so many activities, I didn't have enough time to extend the presentation over. I would have shared a slide, but we're having a power outage. So I'll still go ahead and say, first off, I feel there's been enough engagements with members of parliament, seeing that we have a lot of interventions being done by so many SRHR players, the board itself, the whole congregation of members within the body I just mentioned, and the engagements between the parliamentarians themselves with the young people and their constituents in about 18 districts, the media involvement. We have had so many articles in the newspapers. We've had advocacy. We have had press releases in Malawi. We've had all sorts of engagements around in the community, at national level and the district level. We've had so many workshops. We've had so many activities going on. We've had engagements with the government, the Ministry of Justice, the Ministry of Gender, the Ministry of Health, and we presented a motion that on safe abortion, popularly known as the Termination of Pregnancy Bill here in Malawi, but then it was blocked, not necessarily defeated. So I could say still that's a good sign. While we're still looking into maybe diverting into strategic litigation, seeing how the political landscape is evolving, I could still say three things to our parliamentarians here and out there. First off, I think it's important that you can use the principle of BI to identify within yourselves key persons who are really honest representatives of BI, and specifically in this context, the safe abortion. So you could go ahead with advocacy with partners that are already interested and already vested in the work. Secondly, I feel it's important to delineate between being a member of parliament and being a member of a political party, because then it helps everybody realize that loyalties are not supposed to interfere with the health rights of other people, particularly in SRHR. And then lastly, I would want to say it's important to confront their priorities when it comes to SRHR on their agendas. I'll just give a brief example of what happened in Malawi recently. We've had our female MPs dress up in primary school clothes, dressed up like schoolgirls, and these are people championing education for the girl child, but they refuse to talk about the safe abortion campaign, which is a bit hypocritical. If I may be as blunt, it's a bit hypocritical on our side, because every advocate is thinking, you are talking about education, but what if this young girl gets pregnant? What if they drop out of school? What if they do not want to keep that pregnancy? So in that vein, I would say it's important to confront priorities when it comes to SRHR. It makes everybody understand where to divert their energy, because you're looking at the CSOs, you're looking at other buyer partners, you're looking at the global population in a sense, and then engagements are starting to become or seem like they're unfruitful. So it's important to look at that. So I have those three key points that I feel we should take home. Thank you.
Thank you so much, Nyatue, for joining us and taking that time to talk a little bit around what's happening in Malawi, and particularly your recent experiences around the termination of pregnancy bill in the country. And I think thank you for your boldness. I think that is the role of civil society sometimes, to be a little bit bold and to call out where there appear to be inconsistencies. And what I take away from your intervention is that thought around comprehensive packages, is that thought around ensuring that we are actually tackling all the issues comprehensively. So whether it's access to information, because all of these issues are actually interconnected. And so, as you say, kind of pausing back and asking ourselves that if we're advocating for this, but we're not advocating for the other thing, what are the implications for that in terms of the comprehensive SRHR package, and in terms of delivering comprehensive sexual and reproductive health and rights and health and dignity in general for our populations. Thank you so much, all three of you. I do recognize you had very little time, and we apologize for that, but thank you so much for your interventions and for sharing the work that you are doing and your thoughts on how you think better engagement with the honorable members would help. Felicita, back to you.
Thank you, Miasha, and my civil society colleagues. That was a very, very powerful session. It was short, but it was powerful. I hope that we will be invited back and have more of an opportunity to expand on many of those points and to engage on the specific issues that each of the three speakers raised. I am very much aware of time and recognizing that we have about 20 minutes left, but also that there are other items that the Secretariat may want to add in order to conclude the session. I would like to now just take maybe 10 minutes, 10 or 15 minutes to give an opportunity to our members of Parliament and the honorable members of Parliament who've joined us, who may want to share the work that they are doing, particularly working with, allies and other stakeholders such as religious and cultural institutions to uproot the norms that deny the rights to bodily autonomy and integrity, particularly as they relate to safe abortion and key populations interventions. So if there are any honorable members who want to share some of the work that they are doing, we can take about 10 minutes to just do some peer learning, some peer sharing, and some reflections from you on how it's going in terms of your engagement with cultural and religious institutions to address some of the social norms that limit the rights to bodily autonomy and integrity, and thus also have an impact on sexual and reproductive health and rights. We already heard earlier from the honorable members from Lesotho, Zimbabwe, and the Seychelles about some of the things they're doing around comprehensive sexuality education, as well as some key considerations in terms of how parliamentarians can help move this agenda forward through parliamentary processes. So just wanted to give an opportunity as we move towards the end of the session for honorable members of Parliament to share some of their work and give you an opportunity to share with your peers what you are doing, working with cultural and religious institutions to address barriers and norms that limit the rights to bodily autonomy and integrity, and in turn also sexual and reproductive health and rights, particularly as it pertains to access to safe abortion and key populations issues. So as we had done previously, can we get a show of hands? So you can use the raise hands function. As I mentioned previously, it's next to the interpretation button, the reactions button, and at the bottom you will find one that says raise hand. Otherwise, you can also feel free to put in the chat your contribution. There is a hand from Honorable Marie Mbalambangu, and apologies so much if I mispronounce your last name. Please go ahead, Honorable.
Ça va maintenant, ça va? Ok.
Ça va bien.
Merci beaucoup, collègues.
Great. Thank you very much, dear colleagues. My name is Anne-Marie Mbilambango. I would like to thank all the participants for the necessary pertinent information that they shared with us. And for the DRC, at our parliament, we are working on the family code. And so, in that regard, we have invited all civil organizations working in the area with the Ministry of Gender regarding cultural issues. We started, and this has been since the previous mandate, the previous tenure. We have worked with young girls, sensitizing them, and the government had the objective to scolarize the girls And this was supposed to be done free of charge. Today, we have many girls that are not scholarized compared to boys. And so we have cultures that make our girls not have the same, level of information as boys do. And there is a new principle from the Ministry of Gender so that these cultures should not be allowed.
Accéder plutôt à l'acte sexuel précocement. Et
Honorable Mbilambangu, are you there?
It's a network issue. I think the Honorable is frozen.
Yeah.
IT, kindly assist. You may proceed with Honorable Mpariwa and Honorable Talita Monakota. Their hands are up.
Yeah.
While DRC gets back online.
Yeah, thank you. Thank you, SG. Honorable Monangkhotla? Please go ahead. I think you are muted.
Thank you, SG. Thank you, members of parliament, and thank you, presenters, for the very, very, very good presentation for today. It was a very good one. Since I'm a member of parliament from rural areas, I'm really touched about it, and especially when it comes to the pregnancy of young girls. And this thing is really, really, really happening, and believe me, it's still happening. And the education of sexual reproduction, I think, is still low. And we, as members of parliament, still we have to talk about it, especially in parliament, because we can still see young girls at the age of 15 or less than 15 getting pregnant. Because this thing happens especially at very, very rural areas, especially what you call them settlements. So you can ask yourself whether this thing happened during holidays, because by that time they are not busy. There's nothing for them keeping them busy. So I think I've talked about it in parliament that in the settlement areas, because there's nothing, because the young girls have to play. Young girls and young boys they are still don't know whether am I a lady or what. So how, I don't know how they really take themselves. And again, the education is still low at their areas. And if you talk to them about it, the only people who can talk to them is teachers and social workers, because those are the only government workers. And because of less education, I think that's where the government has to put a lot of input in it. I've heard the presentation for the guy from Botswana. It was very good, and really we have to work on it. And because of our religion and our culture, the problem here now, what we are facing is removing unwanted pregnancy. How do we go about it? It's still a question to us because of the religion, because of our culture. Thank you.
Thank you very much, Honorable. And I think you raise some very important points, which I think were also speaking to what the previous Member of Parliament started to raise in terms of the challenges that the girl child faces in their diversity, in terms of limited access to information, limited access to services, but also having to deal with cultural and social norms that place them at a disadvantage. And as you were speaking, I recalled a saying that I heard in one of the workshops that we attended that talks about we need to deal with the children that we have and the young people that we have, and not the angels that we want. So there's a certain reality that even we as duty bearers and as custodians of culture, et cetera, have to realize that there are certain realities that we have to face, and that, you know, we need to take our kind of heads out of the sand and face the realities that young people are sexually active, but that our duty is to help protect them from early and unwanted pregnancies, from HIV risk, and from other SRHR challenges. And also, as you were speaking about, you know, young girls being exposed to early and unwanted pregnancies, I was reflecting on some media coverage we've had recently in Namibia about, you know, during the COVID epidemic or pandemic, how many young girls had fallen pregnant and also had not returned to schools. I think towards the middle of last year, when the lockdown had ended, it said something like there were 3,300 young girls that did not return to school because they had fallen pregnant. You know, the plight of women and young girls and marginalized populations in terms of gender-based violence and further marginalization during this time is really critical. And I think we have to also consider the impact that the COVID pandemic is having on some of the challenges that we've been discussing. I will hand over now to Honorable Mpariwa to also share their reflections. Honorable?
Thank you very much, and also thank you very much for the presentations from our partners, civil society. Just to share with colleagues the Zimbabwean experience, we have a new bill, the marriages bill, that has been proposed, and it has sailed through the National Assembly. So when it came to the Senate, chiefs demand recognition of cultural practices of that of lobola before any couple can be legally married under traditional marriage. And this is currently delaying the passage of the marriages bill in the Senate, since the chiefs are demanding their share of having the power to actually have the lobola traditional continue to be recognized. And the chiefs under the setup, chiefs will also be marriage officers. So that is our experience in Zimbabwe, and that is actually one of the responsibilities of where parliamentarians have to play their role in terms of legislation that is actually delayed the passage of an important bill to protect both the girl child and the women in general. Thank you.
Thank you, Honorable. As you were sharing, I also reflected on how much parliamentarians and civil society have in common in terms of our agenda and the work that remains, and the importance of us collaborating and joining hands, because the ultimate goal is for us to see improvement for our own communities, and around things like pushback from cultural institutions, and some challenges with religious institutions, etc., around these issues that are deemed to be so sensitive. It is quite important that we hold hands and strategize together in terms of how we can influence positive change. I see that Honorable Mbilambangu is back. Mbilambangu is back, sorry about that. And I would like to give her the opportunity to continue. We will close the session and the interventions after her input, and I will give some closing remarks and then hand back over to the Secretariat and the Chair, Honorable Mpariwa, to close the session. Honorable Mbilambangu, please go ahead.
Okay, merci.
Thank you for the floor. excuse me, I had some technical challenges, so I lost the connection, so everything has been sorted out. So I was saying that the Ministry of Gender, through its people are working through the ministry, started the sensitization about 2 years ago in villages, from provinces. The head of gender started to sensitize parents, so to tell them that it's not normal in a 21st century to allow children to get married at the age of 15 or 17. So with the order that was given at the level of government, that all girls in school, and then that has motivated a lot of parents. So it also contributed to put an end to these early marriages. So at the level of parliament, I was saying that the law on family code, so we were planning to have 2 articles in this law. So the age of young girls, which was 12, 13 years old, but now we have increased it to 18 years. That is in the law. The girl can get married because we suppose that at 18 years, they've got their matric already. There are those who are still continuing to learn, but while being in their marriages. But before 18 years old, when a girl is married, so there we are talking about a violation, because the girl has been violated because it did not reach the age to be married. That's the reason why we made some provisions. So, and it has brought us it has yielded result, because today when we try and evaluate what is happening in primary schools, so there are a lot of girls as opposed to boys, because we understand that when a girl is educated, so she can take care of herself, of her own hygiene, so she can also know when she's educated, so she can make sure that she does not fall pregnant. She can also be tempted, even when she needs to have a sexual intercourse, she will need to have condoms. So there's also another organization, ABF, which is in charge to distributing condoms in schools. So for us as an institution to bring an assistance to these girls to prevent themselves, to protect themselves against STIs, against early pregnancies. So I think the bulk of the work that is remaining now is to sensitize everyone, to allow these girls to be able to internalize all this. That's what I had to say for my country. Thank you very much.
Thank you, Honorable, so much for coming back and also sharing your experiences and the reflection on some of the challenges that you are facing, but also some messages around what needs to be done and the role that parliamentarians can play. I also want to acknowledge the comment that has come in from, I believe, Honorable Mkandawire, saying that the subject of safe abortion is almost like a taboo here in Malawi. Religious bodies don't even want to hear it. Cultural leaders spite it. There is resistance from all fronts. Bill was prepared and it didn't even get a chance to be debated. So as MPs, we have no audience whatsoever on this matter. And I think that that statement and that comment also reiterates again the point that I was making about the importance and the significance and the crucial need for collaboration between civil society and parliamentarians on items and issues such as these that are of common interest, to strategize on how we can jointly, from our different vantage points and with our comparative advantages, push towards positive change around these issues. Unfortunately, we've come to the end of our session. We're very cognizant of the fact that it has been very, very brief. We've tried to pack a lot into the time that we had. And I know that it must have been overwhelming, but also somewhat frustrating, the fact that we couldn't, go into further detail on many of the issues. And we hope that we'll have another opportunity to engage with you. And at the end of the session, in my intervention, I want to thank SADC-PF and the honorable members of parliament for inviting and having us at the session. We have deep respect for the role of parliamentarians, particularly in promoting the rights to bodily autonomy and integrity. And this includes by removing legal barriers and enacting legislation which improves the sexual and reproductive health and rights landscape, that protects the dignity of people living with HIV in key populations, and also increases their access to SRHR. We also recognize that parliamentarians can use their oversight role to hold the executive accountable for putting in place policies and programs to increase access to SRHR. And within their budgetary function, parliamentarians can ensure adequate investment in SRHR interventions, particularly for those that are most marginalized, and addressing structural interventions or supporting structural interventions that address inequality and rights violations. Finally, we recognize that parliamentarians are leaders and social influencers who can influence public opinion, particularly to dispel the misconceptions, stigmas, and taboos surrounding bodily autonomy and integrity and sexual and reproductive health and rights. We look forward to our next engagement to further explore the issues that were raised and to explore with you how we can strengthen the collaboration between civil society and parliamentarians to promote the rights to bodily autonomy and integrity and SRHR. And with that, I thank you. And once again, we look forward to our next engagement. I will hand over to the SG and the Secretariat, or maybe even let me hand back over to Honorable Mpariwa, who was the chair for the session, to take us towards the closing.
So thank you, Felicita. Before Honorable Mpariwa, just to indicate, honorable members, thank you very much, Arasa, for your collaboration. It's always, informative. It's always clear in terms of where you'd like for us to go with you. And we sincerely appreciate this collaboration with civil society organizations and members of parliament. Honorable members, the program will end here. There was a confusion in terms of what this meeting was about. It is not an HSDP meeting, so there'll be no consideration of minutes. There'll be nothing related to the HSDP committee per se. This was supposed to be a thematic session for all committees of parliament, of SADC-PF, so that we can speak to some of these issues that cut across on issues of concern, national and regional concern. And maybe if you allow me, Honorable Mpariwa, before you hand over, one of the things that keep lingering when we discuss issues related to the subject matter and many others that have been discussed today is the whole issue of how we should begin to interrogate the issue of justice as an absolute concept that cannot be, downgraded, or that should not be negotiated. And as members of parliament, we also need to reflect on the issue of morality. Because a lot of times when we think about these issues, these concepts, we have learned that they evolve over time. What happened 100 years ago is different from what happened 80 years ago, 60 years ago, 50 years ago. We can go on and on. And therefore, these are things that will change over time. And we must, at the end of the day, look at what is good for the people that we represent. I thank you, Honorable Mpariwa. You may wish to close the session. Accordingly, there will be no other matters to consider, as this was a thematic issue for all the committees of the SADC-PF. Thank you.
Thank you, SG, for those remarks and corrective information delivery. And I think it is important that in future we'll have proper communication so that at least we have everyone on board. But nonetheless, thank you very much for that. Let me begin by thanking all the honorable members on this platform. we have managed to log in and attend this particular thematic session, and also to allow me to chair this particular meeting. Madam Secretary General, we always thank you. You are hands-on in terms of the work that should be done at the SADC PF. And thank you for mobilizing even our presenters, the civil society partners who have actually presented and walked us through this particular important issue where one might think they are not affected. But I think bodily autonomy, integrity is quite key in terms of everyone else participating and knowing where they stand and what to do and how. And how parliamentarians can play a key role in terms of doing the right thing and also informing the communities, because we do interact with everyone in the communities where we represent as parliamentarians. That is again our oversight role. And when it comes to legislative, then we need to actually monitor and evaluate in terms of whether the executive is also playing its key role in terms of implementation through the relevant ministries, bodies, and entities. Let me thank you, Madam SG, with your staff from the SADC PF, and also the staff from national parliaments. And I hope and trust that you'll be able to continue to support parliamentarians through capacity training, so that this particular subject is brought to the fore in terms of our role as parliamentarians. And let me emphasize my keys, my favorite subject, monitoring and evaluation, because without evaluating, you cannot measure it. So I want to thank everyone who has managed to log in and participate, and I wish you well throughout the day. And this marks the end of the meeting. I declare the meeting closed. Thank you.
Kindly terminate. Thank you, Honorable. Ronald? IT? Ronald, kindly terminate the session.